Hi everyone, my name's Evan Toms. I'm the Executive Manager of Allied Health Services at Family Based Care. I'm also a registered and practicing psychologist. And today I'm going to tell you a little bit more about the Personality Assessment Inventory, the PAI, and its usefulness as a screening tool in the recruitment process. Psychological assessment for the purposes of determining suitability for employment has become an important part of personnel selection in recent years, particularly for jobs that require considerable responsibility or have on-the-job stress. The purpose of this screening is to identify individuals who either exhibit psychopathology that would interfere with job performance or who possess personality characteristics shown to be associated with poor performance at a particular job. The PAI is generally regarded as one of the top 4 personality assessments in terms of popularity and professional acceptance. It's convenient to administer, psychometrically sound, and extensively researched. The PAI is a self-report, multi-scale, comprehensive tool designed to evaluate the psychological state of adults. It can highlight patterns relating to clinical psychopathology, interpersonal style, and the self-concept, and this can be useful for identifying fit in workforce roles. It's for anyone over the age of 18. It has 344 items, each which require a response using a 4-point scale ranging from not true at all to very true. And depending on ability, it can take about 30 to 60 minutes to complete. The PAI is typically used to assist in the assessment of individual presentations, in treatment planning, and often as a screening tool. The PAI has good reliability across diverse populations. Having been tested on over 2,000 participants, it provides data that can be compared to both normal and clinical populations. It has high internal consistency, which means that each item's response measures what it's supposed to be measuring. Also, comparisons against other personality measures have shown good convergent and divergent validity, meaning that the PAI is unlikely to be measuring something that it does not intend to. It has good test-retest reliability, meaning that if the test was to be taken again, it would highly likely yield the same outcomes. All of this ensures that the collection of accurate and reliable information is being obtained. So as I mentioned, it provides a comprehensive overview of someone's clinical personality profile. It does this by using 22 non-overlapping scales which fall under the validity scale, the clinical scale, the treatment scale, and the interpersonal scale. There's also 27 critical items in the test across 9 different content areas, which, if elevated, suggest follow-up may be required. A couple of examples of these are if somebody marked anything other than false to the item, I have no interest in life, which is relating to depression, or anything other than false to the item, I've been troubled by memories of a bad experience for a long time, which relates to trauma experiences. So all of these scales which are built into the PAI are rather impressive. The validity scales make sure that data is valid for interpretation, and the main scales which influence the validity scales are the inconsistency scale, which checks and ensures that responses remain steady and consistent throughout the assessment, and this also promotes reliability. It does this by asking very similar things, just in a variety of different ways. The infrequency scale captures if someone is responding carelessly, randomly, or idiosyncratically, and these items are neutral with respect to psychopathology and have either an extremely high or low endorsement rate. The negative impression management scale highlights if someone has exaggerated responses or tried to present an unfavourable impression of themselves, or if they're malingering. And the positive impression management scale is the opposite. It suggests if a respondent has presented themselves in a favourable light or if they were reluctant to admit minor flaws. If any of these scales crosses a certain threshold, then the outcomes are suggested to be interpreted with caution, and more extreme elevations can render outcomes completely invalid and no interpretation is able to be provided. So now we'll move on to the clinical scales of the PAI, which are mapped with DSM and ICD disorders. They assess how likely a person's responses correlate with a clinical population or syndrome, and significant elevations in scores prompt clinicians that there is a higher likelihood of a particular presentation and that a further assessment of flagged areas is warranted. The broader clinical scales look at the following disorders: preoccupation and worry about health and physical well-being, physiological, cognitive and affect-related symptoms of anxiety and depression. Anxiety-related disorders goes a little bit deeper, assessing phobias, traumatic stress, and OCD presentations. Symptoms of mania, traits in line with paranoid personality, a range of behaviours across the spectrum of schizophrenic disorders. It looks at borderline features, looking at relationships, impulsivity, affect and anger stability and instability, antisocial features, which queries the history of illegal acts, authority problems, egocentrism, lack of empathy, instability and excitement seeking, and the problematic consequences of substance and alcohol use and potential dependence. So here's a look at some of the output, which is calculated from a completed PAI. You can see that the clinical scale can be further broken down into 3 subscales for each, and this provides us even more insights, such as how anxiety or depressive traits are typically experienced, specific preoccupations with health, possible trauma history, negative relationships history, self-harming behaviours, stimulus-seeking behaviours, and more depth regarding aggression-related traits. Some new additions to the PAI have seen the addition of some new scales. It can now flag any marked elevations regarding things like negative affectivity, detachment, antagonism, disinhibition, psychoticism, manipulativeness, deceitfulness, hostility, risk-taking, and rigid perfectionism, just to name a few. The PAI will also evaluate a person's likelihood to engage in treatment or to seek assistance for their mental health. It flags other potentially associated issues, such as their tendency to engage in aggression, or likelihood of acting assertively, suicidal or self-harm experiences or tendencies, impact of stresses, and perceived lack of supports, and their attitudes and motivation towards seeking help or treatment. Also assessed in the PAI is a person's interpersonal style. It does this by interpreting scores on items relating to dominance and warmth. Dominance is how controlling or submissive a person is, and warmth is how empathic, personable, or cold and rejecting a person is. So now that we've gone into a bit more depth about what the PAI is and you know a little bit more about it, the next question is, how does it help with recruitment? Well, the PAI can form part of an organisation's management of psychosocial hazards. By identifying reasonably foreseeable hazards that could give rise to psychosocial risks, the PAI can be helpful in preemptively eliminating or minimising risks so far as is reasonably practicable. It can also form part of maintaining implemented control measures which assist in facilitating a work environment that is without risks to health and safety. It can be helpful to think of the PAI screening in the same way that a medical will screen for physical fitness. The PAI can assist in the screening of psychological fitness. The PAI can help to better understand individuals by identifying their potential strengths, risks, and vulnerabilities. For example, how an applicant gets along with others. Are they warm and sympathetic or direct and unapologising? Do they value harmonious relationships or shun controversy? Do they have difficulties managing conflict or being assertive? Are they likely to hold a grudge? Are they likely to forgive others? Are they likely to demonstrate aggression or hostility? How do they see themselves? Are they stable within themselves? Do they worry about their competence or adequacy? Will they acknowledge their limitations or appear reluctant to recognise faults or problems they experience? When providing feedback from the PAI, the My Psychology Tasmania clinicians will also identify potential support strategies for your consideration. The PAI gives you the opportunity to understand your applicants on a deeper level. It will help you identify areas for follow-up which standard interviews are unlikely to catch. It will also help you make more considered and more informed decisions. It could be a crucial step in identifying potential psychosocial hazards, assessing their level of risk, and then implementing control measures or support strategies to minimise those risks. It could also be used to gain insight, which might help to motivate staff too. So as I mentioned, it really is similar to a physical fitness screening. This is like a screening for mental fitness. Some examples of adjustments at family-based care that came from the PAI feedback include identifying strengths of person-job fit to various roles, developing individualised support plans for staff, including increased confidential debriefs, reflections and feedback, which is particularly helpful for those who are less likely to be assertive. Line managers are having more considered approach in their communication styles. All of this helps family-based care to not only protect itself as an employer, but also to protect employees and clients from potential harm by engaging in better management approaches generally. All of the clinicians at My Psychology Tasmania are trained to administer and interpret the PAI. We act strictly as an independent assessor who is hired to perform the PAI. We don't get involved in decision making, but we do provide the feedback for your consideration. Because it's easily emailed directly to participants, our team aim for a 2 business day turnaround pending the candidate's prompt completion of the assessment. The team performs these assessments on an as-needed and ongoing basis. So if you'd like to know more about how this assessment could be of benefit to you or your organisation, please reach out to me. My details are there on the screen. I'll send out some feedback letter examples so you have a better idea of how this information is communicated. It'll also demonstrate how the outcomes can vary quite a bit between respondents. Thank you everyone for your time.